I'm going to take you through a hip warm-up from the mat. Okay, so you want to sit on your mat or lie back on your mat. Okay, you're relaxing your head back, relaxing the shoulders back, the inside of the arms and palms are facing the ceiling. So first we're going to talk about tilting the pelvis. So this is an anterior tilt, this is a posterior tilt. So you're bringing your low back down into the mat on the posterior tilt, the low back lifts up on the anterior tilt. Okay, so you're just rocking through. So you're not using your feet, okay, to jam your low back down. You're using these abdominal muscles, okay? So keep your feet light, try not to add extra pressure with your feet. Use these abdominal muscles, use your exhale, bring the low back down, and then relax these muscles, and then allow the hips to tilt and the low back comes up, okay? So use the muscles and then relax, okay? So then we're gonna rotate side to side, so you're just bringing the knees up, hands on the knees, and you're just rolling side to side. So you're not going all the way over here. So you're just rolling to the midline of the hip on one side, midline of the hip on the other side, okay? So you can hold your knees or keep your arms out to the side. Just roll from side to side. You're rolling across the hip crest, not the low back. So just rolling across your hip, side to side. Okay, and then you've got your feet touching each other, hands on your knees, and then circle the legs around. So you're bringing the knees in, open wide, circle around. Feet are always touching, bring them in, open wide, circle around, and you can go the other way. Push away, open wide, circle around. Push away, open wide, and circle around. And you're just steady breathing on most of these, okay? So then we're going to do a bridge. So we're not going to bridge up like you would in yoga where you're clasping your hands, drawing your legs together, lifting up. We're not going to do that one, okay? So all we're doing is we're going to just kind of articulate the spine. So you're relaxing your arms and you're going to lift up. So you're starting to lift from the hip first. So you're articulating the spine, one vertebra before the next to lift up, okay? And then slowly you can do an exhale, one vertebra before the next, lower down, 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 even to the tip of the tailbone where that low back would go up. And then start to take the low back down, articulate the spine, lifting those hips up. Okay, so this is a nice little warm-up, a little bit of a strengthener for the hips as well. Lift up. Keep those shoulders relaxed, keep the arms relaxed, don't press into your hands. Okay? Okay, another one we'll do, stretching the hip flexors in through here. So take one foot on each side of the mat, and then just tilt your legs over. If you find any pain in through here, you can prop something underneath your leg. Okay? So what you're trying to do is feel a stretch in through here. Okay? Some of you will feel a stretch right away. If you don't feel enough of the stretch, you can adjust where your foot placement would be. Okay? You can also, if you draw these muscles in and lengthen it as though someone is grabbing your thigh and they're pulling it away from your hip, you're going to feel that stretch all through in through here. Okay? And you would hold each position, do each of those moves like 30 seconds each. So you're going to go to the other side, same thing, draw these muscles in, lengthen that thigh away, and feel that stretch. Okay, and then come back to center. So we're going to take the legs up, so you can hold on to the back side of your legs, bring your legs up. If you can't straighten them all the way, that's fine, just keep them here. Point and flex your feet. Point and flex, and straighten them, point and flex. So this is a plantar flex, this is a dorsal flex. So you're pulling the toenails towards your shins and then you're pushing them away. And then circle just the feet, not the entire leg, just at the ankle. So you're circling the feet and then circle the feet the other way. Okay, and then bring it all the way down. So another one you can do to kind of warm up the glute a little bit. Just keep the heels, slide it down, squeeze this cheek. You're going to feel a little stretch here as well. Squeeze the cheek, you feel the stretch there, and then drag the heel back. Lengthen it away, squeeze the cheek, and bring it back. Lengthen away, squeeze the cheek, and bring it back. Other side, lengthen away, squeeze the cheek, bring it back, yank it away, squeeze the cheek, and bring it back. Okay, so the next one we're going to do is, this one actually is a good prep to stabilize your core and strengthening these deep core muscles here. So you're going to draw these muscles in. They're the muscles directly above those Kegel muscles, but south of the belly button. So you're drawing these muscles in. So you don't want the low back to lift, and you don't want to jam the low back down. So you're trying to keep it neutral, okay? And you're going to exhale through the move, because the exhale helps also with the rib cage drawing in toward the spine, and that will give you a little more stability as well. The arms are down at an angle, okay? So you're going to exhale. You're going to come up on your toes, exhale through the move. The angle at the knee does not change. Touch back down. Pause for an inhale, engage these muscles, exhale through the move, and bring it back down. Pause for an inhale, engage these muscles, exhale through the move, and bring it down, and pause, inhale. So notice on the way down, you're going to notice that your low back wants to lift up. So that's where you really are going to use these muscles, so the low back doesn't lift up and you can keep the low back neutral. So on the way down, you're going to feel your low back wants to lift. So use these muscles, keep that exhale going, touch down, pause, take your inhale, exhale through the move, touch down, pause, take an inhale, exhale through the move, touch down, pause, take an inhale, exhale through the move, touch down, pause, and take an inhale. So you can do these, and then you can lightly just bring your knees in and just hold. So you can do these warm-ups. I prefer to have my clients do them at night. Even though it's not a huge range of motion, each of these moves, you can do them in the morning because it's not a large range of motion. Your body's not warmed up yet. So I prefer to have them do them in the evening. But you can try them in the morning if you feel pain. Do it again at night and you'll see the difference because you've had all day to kind of warm up, move around, and do things. So at night, you know, you can gain more flexibility with your body when you do a lot of your stretching in the evening.